We are very excited here in Cobleskill to be offering Platelet-Rich Plasma, or also considered PRP. We have been trying for the past 2 years to get it here in Cobleskill, which is the only location in the Bassett Network that provides this service. And essentially what we do is we draw the patient's blood, we spin it down in the centrifuge, which is right beside me, and it concentrates plasma, which is filled with all of the good stuff in blood, the platelets, the proteins, the growth factors. And what that does actually helps repair damaged tissue and actually helps regenerate cartilage. So this is a great option for people that have joint pain, ligament problems, and potentially a tendon tear that they don't want to do surgery for. It could be younger athletes that have a sport injury like a rotator cuff tear, patellar tendonitis, or an ACL tear. It could also be used, and what a majority of my patients are now, is patients that are needing hip replacements or knee replacements, and they essentially don't really want to go down that route just yet. So this is a great non-operative option for a lot of my patients. If you're interested in PRP, get a referral from either your primary or within our ortho department if it's something that you're interested in. You have to see me for what's called a PRP consult. So we'll talk about what the day looks like, what the PRP procedure actually is. We'll talk about pricing. PRP is not covered by insurance. Hopefully in a couple years that may change, but as of right now, no insurance will cover this. So if we do one area of concern, whether a shoulder or an Achilles tendon, it's $700 out of pocket. If we do two sites, like let's say a right shoulder, left hip, it's $850. So that pricing definitely need to take into consideration. And then the actual procedure day will likely be scheduled a couple weeks after. Plan to be here for an hour. It does take about 25 minutes to spin by the time we do the blood draw, the injection. So the whole kind of procedure day is about an hour. After the procedure is completed, so we draw your blood, we spin it down in the centrifuge, we inject it at whatever area of concern, you are going to be sore for a couple of days after. So the current literature shows about 72 hours after PRP is injected, whether that's a tendon, whether that's a ligament, or whether that's a joint, you are going to have inflammation. But this is what you paid for. You want that inflammatory response. That's what's going to recruit all of the healing factors in blood. So you are going to be down for the count for a couple days, not necessarily meaning laid up in bed. I want you moving. I want you using the joint or the area that we did inject. After the 72 hours, you should be great to do all your everyday activities. So really, there's not a lot of downtime. The great thing about PRP is that it's your own blood products. Your body has its own natural way of trying to heal itself. And what it's trying to do, this PRP, is trying to kickstart that process.